Hi, everybody. It's Dr. Chris Bunn from the Atlas Clinic here in South Ogden. Wanted to talk to you today about the role of the upper cervical area in breathing, and specifically sleep apnea, snoring, those types of things. So I'm going to show you some CT images that we took the other day on a patient of ours. I want to highlight a couple of things here. So this is a side view of the neck. What we're looking at here is the skull, the jaw, and the spine. Now, I want you to notice something about this spine right here. This spine is very straight up and down. And what that does is creates a situation where the head, if you can see me down here in the corner, the head becomes flexed forward. As that neck straightens out, up and down, your neck flexes forward. So if anybody's ever done CPR before, what's the first step in CPR? Obviously not sweeping the mouth and removing whatever they're choking on, but what is it? It's when they're laying down, opening the airway, right? Hopefully you all remember that. But if we take a look at this again, you can see how if that neck becomes flexed forward, it shuts down the airway. Now, why would this neck become flexed forward like that? That's a good question. So if we take a look at the frontal view here, as this top bone in the neck becomes subluxated or misaligned, what happens is you start to shift the entire neck on the head. You see this white line here? That's the center of the skull, and it should intersect perfectly with the center of the spine. You can see that it's shifted off to the left here. So that creates all sorts of muscle spasms in the neck because there's an injury there. So what the neck instinctively does is it tightens up and it straightens up. And what that can do is that can create a narrowing of that airway. It can create snoring, sleep apnea, and all sorts of problems associated with that. So this is something that we can help you with by adjusting this upper cervical spine, help you to restore that normal curvature and open that airway up just based on increasing the width of the airway behind the tongue and opening some space up due to neck injury and neck trauma. So hope you got something from that. Hope that opened your eyes a little bit this morning. If you're interested in our help, hit the website link, atlasclinicutah.com. Free consultations and exams. Love to see you. Take care.